Yeah, so hello everyone. I'm Jake Trippett. I am second year medical student at McGovern Medical School. I'm the executive director of operations here at Med School Mentor. So I'll be leading this panel discussion. So we first wanted to start with kind of a brief introduction from all of our panelists, probably about a 3 to 4 minute introduction from each of our panelists if they just want to give brief information, what they matched, and any more information you want to give. So we can get started. Does anyone want to start?
I'll do Megan. Go ahead first.
Hi, everyone. My name is Megan Goyle. I am from Dallas, Texas. I currently go to McGovern Medical School. I matched into Rush University for neurology.
All right. Malika.
Hi, everyone. My name is Malika Tripathi. I am from Houston, Texas, also fourth year at McGovern Medical School, and I matched MedPeds at Baylor College of Medicine in Houston, Texas.
All right. Jose, let's have you two introduce yourselves.
Hi, everyone. I'm Jose Torres, also a fourth year at McGovern Medical School. I matched neurosurgery at the University of Maryland in Baltimore.
And I am Vilon, and I'm his fiance. That's why I'm here. But I am originally from Houston. I currently go to A&M Medical School, and I just matched into OBGYN at the University of Maryland.
All right. Let's continue. Let's keep going on. Who wants to go next? Alex?
Yeah, sure. Hi, everyone. My name's Alex. I'm also from McGovern. I matched back into McGovern for diagnostic radiology.
Yeah, Alexis.
Hi, everyone. Hope you can hear me. I'm Alexis. I'm originally from Houston, Texas, and I matched psychiatry at McGovern.
Great. Brian.
Hey, I'm Brian. I am also a fourth year at McGovern Medical School, and I matched ortho at Emory.
Awesome. And Delaney?
Hi, I'm Delaney. I'm also a fourth year at McGovern, and I matched general surgery at Maine Medical Center.
All right. Did I miss anyone?
That was
No?
one.
All right, great.
So we can take questions from the audience. We're going to use the hand raise gesture, and just anyone who wants to ask a question can raise their hand, and I'll call on them, and then whoever the panelist wants to answer, go right ahead. Ankush, are you still muted?
Man, I'm muted, yeah. I think we should just go around, hear about everyone's stories, They already said what they matched in, why they chose that specialty, if they, did particular research, just their journey towards that. So we'll do like 3 or 4 minutes per person. So we can start with Alex first for DR.
Yeah, I think so. For me, I was deciding, I think, between specialties like before coming into medical school, between kind of like primary care and diagnostic radiology. I think for me, quickly, I learned early on that radiology was something that fit more of my interests, I guess. Just because it's something that for me, I think radiology, you use it in just about every field. For those of you who are going into medical school, you'll find that it's very prevalent or imaging throughout like almost every field. And I think that I decided that pretty early on. I think that helped a lot when I was going through the process of, I guess, like applying. And I think that showing like a clear interest like early on, not only for this specialty, but just like a lot of specialties in general was really helpful for me.
Jose, we can just have you go next.
All right. So for me, what drew me to neurosurgery was when I came to medical school, I was trying to decide what specialty I really wanted to, dedicate my time to. And luckily, I was stuck with a preceptor who was a neurosurgeon, and being in his clinic and seeing his patients, it struck a chord in me because people came in with debilitating conditions that without intervention would realistically just not lead to good quality of life or good recovery from whatever they presented with. And I felt that the direct and tactile nature of the neurosurgical part of it really lent itself best to what I enjoyed, which is like the acute care of people who have these debilitating conditions and seeing if we can make them, recover any quality of life, any functional recovery, and being that sort of first, acute person that can help manage them.
I guess I can go next since I'm here. My journey to OB-GYN really started with me applying to medical school because I saw myself being a primary care provider. When I think of doctor, I think of that family doctor that you see and grow up with. So that's what I had in mind. That's the only doctor that existed for me. So I came in and I kind of started fresh in that sense and kind of explored my options. I already cared about women's health and I knew I wanted to incorporate it, but I didn't know the extent of it. And when we started Anatomy Lab, I realized how much I loved surgery. I loved getting my hands on, and I realized that OB-GYN would give me all these things that I was already so passionate about. And it kind of just like, I think I fell in love with the field very naturally. And over the years, I think nothing else really changed my mind from that. And I loved everything, but I really, really wanted to do OB-GYN. So I think we're very lucky to be here. And I just wanted to note that we did go through the couples match process if anyone has any questions about that, because we knew we've been together for 7 years now, so we kind of known and planned for it for a long time. So we're probably well equipped to answer any questions like that.
Yeah, that's really important to keep in mind. The couples match, they did a very tough couples match, neurosurgeon, OB-GYN, I mean, both surgical specialties, and it's challenging because you have to, first of all, you may not get the same interviews everywhere. So you get the same interviews, that's perfect. If not, then you have the same city. So there are a lot of things, nuances. So anyone who's considering a couples match, I mean, you can just, raise the hand here, ask a question, put it in the chat and we'll bring it up.
Right. Alexis?
All right. So, like I said, I matched into psychiatry. When I came into medical school, I think that I didn't really have much in mind as far as specialties. I really wanted to keep things open and see what was out there. And so, kind of throughout the preclinical time where you're kind of doing more like lecture and book learning, I really just found everything really interesting. But I did start to feel that the psychiatric diseases were like very interesting to me. I've always been interested in psychology anyway. And then when we got into clerkships, which is where we actually go through different experiences in different fields, again, I was trying to keep a really open mind and I loved a lot of different fields. But when I got into psychiatry around the middle of my 3rd year, I just felt like it was a little bit of that extra excitement that I didn't know was not as present in those other rotations. And so I didn't decide at the very beginning of med school, but I kind of just saw where experience took me. And here I am now.
Awesome. Thank you. Brian?
Yeah, so I came into medical school only sure of one thing, which was that I would not do orthopedic surgery. I said I would consider any other specialty except ortho. And here I am 4 years later, starting an orthopedic surgery residency. So I guess my advice to people early in their careers is think, don't rule anything out. And the way I got into orthopedics was a friend was going to shadow overnight with the residents one night and didn't want to go alone, so invited me. And I just saw a different side of orthopedics than what I thought the specialty was. So if you have the time during those preclinical years, really use that time to shadow broadly, and like shadowing in your specialty of interest is good, but also take a random half day and go see endocrinology clinic or like fertility clinic, because you have no idea what's out there. And the more you expose yourself to early on, the more you'll just know what your options are before it comes time to make that decision.
All right. Awesome. Malika?
Yeah, so my journey to MedPeds is kind of a culmination of my experiences kind of coming into medical school. I already had a strong passion for pediatrics and advocating for those communities. But in medical school and especially third year rotations, I kind of found an interest in MedPeds specifically and kind of the philosophy of MedPeds. I think, adding on to my interest in peds, I thought a lot about it during third year and I realized that I didn't really want to let go of adult medicine just yet. And I really found an interest in transition medicine, which I think is a unique aspect of MedPeds, in that, as we see our young kids with chronic conditions kind of aging out and growing into adulthood with new technology that's developing in medicine, transition medicine becomes all the more important. And so I found a really strong interest in that, especially for kids with chronic conditions and complex illness. And in addition to that, I think I also found an interest in geriatrics through my internal medicine rotation, as well as our geriatrics week that we have at McGovern. And so I think all of that kind of pointed me towards caring for individuals across the lifespan. And that's kind of what led me to solidify my interest in MedPeds.
Awesome. Awesome. Thank you. Megan?
So my journey kind of began in college. I was a neuroscience major, and so I've always been really interested with this field. But in college, I did my clinical shadowing hours, and I shadowed a neurologist, and I did not find it very fascinating. I was very confused with the physical exam. It was very much like next patient, didn't know what was happening. And so when I came into medical school, I was like, I'm not going to be a neurologist. I did not find that fun. And I was willing to explore any other specialty. Then loved my, our neuro block preclinical year, went into clinical year very open, and I had neurology as my second clinical rotation, and I fell in love. I felt like I was in home. I loved the physical exam because I finally understood it. I loved the patients. I loved having the long-term relationships with them. And then in fourth year, I did a movement disorder month rotation, and I loved being able to see my older patients who have Parkinson's and Huntington's and really getting to know them. A lot of them, were seeing my attendings for 20 plus years. And so you really knew them, their family, and you were able to see the significant differences with the medication and DBS. And so I'm very excited to be going into this field.
Yeah, we tried to recruit her to neurosurgery when you rotated with us. She was with me on my service, but she did well, but she couldn't budge from neurology.
And then Delaney.
Yeah, so my journey to general surgery started pretty early. I would say in undergrad, I was interested in chemistry and was doing a lot of work in a chemistry lab. And I realized that it was much more focused on industry. And so that kind of took me to medicine and eventually to general surgery, because to me, the part of medicine that I'm most interested in is sort of when an acutely ill patient gets taken almost all the way back to normal. And in general surgery, you get to do that all the time. So it was a pretty natural choice for me.
Awesome. Awesome. Thank you so much. Well, I wanted to start it out with questions kind of tailored towards the MS3s that I know we have quite a few of them in this chat. Megan did ask, can you guys talk about your timelines for the ERAS applications? I'll also extend that to kind of the time frame of the end of third year going into fourth year. What should they expect, and kind of what was y'all's timeline, and with starting applications, looking to where you wanted to go, any sub-Is, anything like that? Whoever wants to start can feel free.
I can start. I would say with third year ending, for most people who are on the traditional path of applying to residency, like in fourth year to start residency right after medical school is done, I would say focus on step 2, get that exam kind of done before you start thinking about applications. I think the main thing with ending third year and transitioning into fourth year, and especially the early months of fourth year, is it's a lot all at once. But I think if you kind of compartmentalize your time and focus on one thing at a time, it's kind of better for not only those different things and getting those things done, but also for your mental health and sanity. So I would say focus on step 2, get that done. And then most people will kind of get step 2 done before they try to do their sub-Is. And that's kind of like the general thing that happens, at least at McGovern. And so I think that is a good time to start thinking about your sub-I, and especially if you have to do away rotations, which someone else on the panel can definitely speak about since I didn't do any. But I think getting your sub-I done early, if that's something that's important for the residency that you're applying to, is also important. As someone who applied like to a more primary care specialty, that is definitely very important because you get your rec letter from there. And so just try to make sure that you are also prioritizing, if that's important to you, getting a little bit of a break between step 2 and doing your sub-I, just so that you're on like your best foot for your sub-I, since that is a really important rotation. But if it's not something that you have to do for a recommendation letter for the residency that you're applying to, also try to think about what electives you'll need to do. For example, dermatology people typically do derm electives really early on to get rec letters from there. But try to like prioritize having those pretty early on so that you can have that and have rec letters from there. And then I think that ERAS is usually due like end of September. At least that's what it was last year for us. And so just making sure that you are getting all of your ducks in a row for that application process is important. And everyone's kind of timeline is different. I think most people try to get the rec letters kind of in by mid-September, like shortly before the application's actually submitted and off. So that means that you need to start talking to your rec letter writers before then, of course. And then up till then, you're kind of working on getting your activities together so that you can get it into ERAS. You're getting your personal statement written, read, drafted, edited, all of those things. And so I think that that's kind of a good thing to be doing in like August and July, but also focusing on those rotations that are important to get rec letters from.
Yeah, I'll go ahead and piggyback off of that, Malika. So the way that I kind of went about things in third year, again, was just being like really open to everything, trying to put my best foot forward in every rotation, and also considering like, you know, the relationships that I built, the mentors that I had, and who would be good to ask for rec letters from. Because for most specialties that you apply to, like you might need a letter that's not from your specialty anyway. And so I think it's good to build those connections just everywhere, because you also never know, you know, what you're going to end up doing for the most part. So because in third year, I found people who would write my letters for me. When I was scheduling my stuff for fourth year, I focused more on things that I was interested in as far as electives, things that could give me more letter options if I wanted. But I chose to do my sub-I kind of after the point where you submit your applications, just because I didn't necessarily need a letter from that. And so I think with like good planning, you can kind of avoid having to kind of compete for those sub-I spots, because at least for us in psychiatry this year, we had a lot of people and it would have been impossible for all like 20 of us to get our sub-I before applications were due. So just something to consider.
It's really interesting to hear what everyone's stories are, because I do think mine varies a little bit differently, because in third year, I would say like January is when I started looking for someone in the specialty I wanted to ask advice from, as in which OAs do I apply to? I knew I wanted to do OA, so that's the time, like towards the end of clerkship is when I started looking into where to apply, like getting my immunizations together, like my paperwork. If I need an essay, draft a really bad one and be done with it, and have that ready and on the side to apply whenever that thing opens. And then immediately I dove into step 2. And when I'm doing step 2, I'm not thinking about anything else. Like your VSOs have been done. This is like step 2 is now your priority. And then once you're done with that, if you have time to honestly take a break, do an elective, do that. I timed it poorly and I did not, but it turned out okay. And went straight into 4 sub-Is that semester. We were just applying very heavily to increase our chances of matching together. So that doesn't mean that everyone has to do it. I also want to emphasize that I remember in med school being very stressed about finding like a super meaningful mentor in 1 and 2 year, and like having that 3-year special connection. And that's not always the case, and not everyone will always find that, and that's totally okay. So I think I'm just voicing that to tell people that if you find that person, that's awesome. But if you don't, you will eventually get your letters, especially during 4th year when you're now, you know, like your last year of medical school, you've learned everything there is to know, and you can really perform at your best to get the best quality letters of rec, right? So I just wanted to voice that out. And then during my sub-Is, on the weekends and things, is when I kind of started putting together my personal statements and my applications and just slowly working on it rather than trying to stuff it all into 1 week before it was due. And I think that helped a lot.
Yeah, I agree. It's for me, I also timed step 2, so I'd finish step 2 and then immediately go into my home sub-I, which is not the best timing thinking about it now because you definitely want a break to go like relax and unwind and then go into your sub-I. But I feel that when applying, and so just applying for ways specifically, you need to time it so you have enough time to get those letters. And those letters are so critically important, especially if you are applying something surgical. These letters are sort of them vouching for you, saying that not only are you great at home, you're great in this other setting with brand new people, you're great at working as a team and brand new situations and people in a system you don't really know. And having enough time to get those letters and having enough time to communicate between you and the letter writer or you and their coordinator or you and their assistant, I think it's critical just because you don't want to be at the very, very end right before September and all of a sudden you're springing on them. You need a letter in the next week or two because you're not going to get a very good letter. These letters are very thoughtfully written, and I feel that you need to give them time to do that.
Definitely think the best way to kind of gauge what that looks like for your specialty is to have some kind of mentor, whether that be your advisor at school or just like someone who recently graduated at your school to kind of give you the deets on that. Because I didn't feel that kind of letter writing pressure, but I did make it clear like within the first week that that's something I was looking for. And most sub-I faculty are very aware of that. So there's like, it's not that much pressure to ask.
Just to chime in real quick, because I forgot to mention it, I didn't do any away rotations for psychiatry. Usually you don't have to unless you really want to go to specific programs and you really just like want to maximize your chances of going there. I always knew I wanted to stay in Houston, so that was not really a factor for me. But I did have a letter writer not be able to write me a letter with like maybe less than a month left before submission. So that was when the connections that I built during third year really came through for me.
Awesome. Yeah, go ahead, Brian.
No, I just had two very quick and pointed pieces of advice. One is start earlier than you think. I gave myself September off, like between my away rotations, thinking I would just give myself the 1 month to work on the application. But then I started getting emails from my school saying they wanted drafts submitted to the Office of Student Affairs in early June so that the mentors and the deans there could read all 240 essays. So the timeline I had in my head was not at all what the school's expectations were. And then I found myself on an away rotation trying to also put my application together. So expect to do the bulk of the work in like June, July, and then when it comes to September, you're really just going to be copy pasting it over and entering it. And second, what was the other thing? One thing, everyone thinks about putting in their experiences and their research and putting together their application. But with the advent of signaling and being able to choose the programs that you apply to and kind of show them that you're acutely interested in attending there, one thing that I didn't give enough time or consideration to early on, and I wish I had, was giving thought to which programs I'm going to apply to, because that can really affect how you write your personal statement or what you emphasize on your application. And so I wish I had done that earlier in the process to kind of know what the target was before I put all this put the whole application together, and then you're trying to choose the schools that you think you have a good shot at.
Yeah.
One thing that I thought was really helpful was getting together your CV early on. You probably already have like a rough draft for applying to medical school, but whenever you have time throughout the next couple of months, just updating it with whatever you've done in medical school, and using your resources online on how to write really good statement sentences for the activities that you did. And I sent mine to the Office of Student Affairs and got it back with some reviews, and having a really nicely done CV was very helpful because it was just copy and pasting into ERAS. And so it took away a lot of the hard work in ERAS and spending time doing that.
Awesome. Thank you. And now we're going to kind of shift gears just a little bit. Question for the people in the audience who are M1s and M2s, because I also know there are a lot of those, like myself. How should they pick their specialty? And on top of that would be kind of looking towards the surgery versus non-surgery, that kind of aspect of things. And just whatever advice anyone may have.
I can start. This is something I think it's important to do the work early when deciding your specialty. I think you hear a lot of people talk about how the preclinical years are so great because it's mostly independent study and it's self-paced, and you have so much free time to explore your passions or do research or explore those personal interests. But when you're trying to decide a specialty, if you land on something that's competitive, you're going to want to know as early as you can to help build your application, whether that's right, wrong, or indifferent. So I think that being efficient with your time and then making a concerted effort to see as many things as you can early on. All my shadowing experiences, if you go in there and say that you're a first year, every resident, every attending is just going to be impressed that you're taking the initiative to get in the clinical setting before it's expected of you. So you'll learn a lot, and they will be super happy to have you and teach you, and the expectations are extremely low. So it's a really safe learning environment. And I think just building that into your regular routine to try and see as many different things as you can. And then as you narrow it down, spending more time in the specialty that you're interested in is something I wish I'd done more of on my path.
I agree with that. I would say exposure is key in medicine. I think, especially in the preclinical years, like a lot of us do like preceptorships, but it might be randomly assigned, which is good in a way because it maybe gets us exposure to something that we wouldn't have chosen to get exposure to. But at the same time, I would say that if you just like change your mind in your third year, or you find something that actually is your passion, like just because it's your third year and it might be something super competitive, don't let that be a barrier to you applying for that. I would say, of course, everyone's on a different timeline and there might be other factors you have to consider. And some people don't want to take gap years for whatever reason. But I think that at the end of the day, it's really important to do what you really enjoy doing. And if that changes really late on in third year as well, that's okay. I have a friend who was like very much going to apply peds. His last rotation was OB-GYN. He applied OB-GYN and he's an OB-GYN resident at Hopkins. And so I think that that is a testament to the fact that you can change your mind at the last minute and it still ends up being okay. So I would say that even if it ends up happening where like you at your very last rotation end up doing something very different or liking something very different, just find a mentor who can kind of help you on that path to applying for that different thing. But don't let that be a barrier to you pursuing what you actually are really interested in.
I want to say, as the only person who's not from McGovern, my school had a lot of faculty, or like doc talks, they would call them. And every month they would host like one of our resident like school faculty in a different specialty to talk about what they did, what their life looked like. Because as medical students or M3s, you mostly work with residents, so it's kind of hard to see what your final level would look like, right? So they kind of gave us a lot of insights. So we kind of just go to the ones, or just hear people out in something that I could see myself being interested in. And for M1s, if there's any M1s in the chat, I had spent any summertime, if you're lucky enough to get some kind of summer break, to really use that time to shadow and see anything. And even if it's not what you end up being doing, it's not a waste of time, because you know why or why not you're passionate about it. And if you are, like, what aspects you like the most, and if there's any other specialties that overlap with that. And my M1 year, I ended up cold calling and cold emailing faculty around Houston, and ended up doing just a quick preceptorship just to really see if OB-GYN was it for me, and I ended up loving it. And I think that made it so much easier for me to really dive into and kind of build up my application for that. So I feel like during M1 and M2 year, if you have any opportunity to just kind of see them early enough and ask, silly questions as an M1 and M2, and because you definitely feel more pressure to be more professional than M3, then you'll kind of be better prepared as you go into clerkship, and then you kind of know what kind of doctor you want to be, what kind of resident you want to be.
Awesome. Thank you so much. Real quick question. Are there any character limits on ERAS for the CV? Does anyone know?
So it's not like you upload a CV in its entirety and then that gets to the ERAS. Each section has its own set of, like, you'll put in the name of the experience, the location, the duration, and then you'll give a brief, I think it's 300 characters. They give a brief description of, like, what is that sort of event in your life / why is it important to you. And you'll get a lot of different advice as to, like, it should be a very, like, verbose statement, it should be a bulleted statement, it should be you should only describe very minimally what you did, but why it's impactful. And you'll get to a lot of different things. And I feel like that depends a lot on the specialty you're going into. Some people want to say, like, why is this relevant to what you're applying? sometimes you do something that's very outside of medicine, but it's something that gives you skills that's very applicable to medicine or to research or to, different aspects of clinical care. And if you emphasize those in your ERAS application, it makes it much more of a profound, like, like event in your life or something to put on the application than just saying I did XYZ research in XYZ thing and it was good.
So just along those lines, as somebody who reviews resident applicant applications, it's always best to highlight why that was significant for you. So as Jose is saying, instead of saying I did research in a lung cancer lab, a world famous, scientist, I work under that person and contributed to X, Y, and Z. Well, that's great, but what did you get out of it? So we want to see you're able to realize what is really transferable over to being a resident, and why that's meaningful to you. That's a lot more meaningful to us because we're going through so many things, and to really stand out is to really be able to reflect back and see, hey, this is actually really meaningful to me for X, Y, and Z reason. Then saying, oh, this is a world famous scientist, so if I put it down, people are going to be impressed. Well, not really.
All right.
Just in general, sorry.
Oh yeah, no, go ahead.
No, just in general, I wanted to make sure that my application kind of told a story as to like why I ended up where I ended up and how my experiences kind of led me to that point. That's just how I was counseled to do the application, but I also think it makes a much more compelling thing to read because people are reading a ton of applications.
And just to add on one thing for anyone who might be applying like next year or in this coming cycle, just if you're curious, it's very similar to like TMDSAS, AMCAS applications in that you'll choose like your top 3 most meaningful activities. So just something to start thinking about. You're gonna at least on ERAS, I know like OB-GYN and anesthesia, I think, have separate applications. Not sure how those applications look, but speaking for ERAS, you get 10 activity slots in all of ERAS. You choose 3 as your most meaningful, and for those 3 specific ones, you're kind of going to add like an extra few sentences about like why that was the most meaningful. So similar to those med school applications.
Just chiming in to say that residency cast for OB-GYN was pretty much the same thing. We get 12 experiences. We only have to list 3 meaningful experiences. We didn't have to elaborate more like than our description, but it looked pretty much the same, just in a different font on the literal website. But it's very much like TMDSAS and all of that.
One question we wanted to bring up, more specifically to this being a med school mentor webinar, is something we hold very valuable is mentorship. So we wanted to kind of ask all the panelists on kind of what was the role of a mentor in your journey to where you are today into your match.
I can sort of chime in on this because I've had a lot of mentors that were both like faculty and residents who had come and talked to about, where am I doing my ways? What should I be looking for in these places? I talked to Ankush here and during my sub-I, and we talk about like how I can be better in my ways and, really hone in on like what's going to make me successful. And I feel that mentorship at an early point in medical school can make a world of difference because you can get exposed to you can get more clinical experience with a mentor, just spending time with them. You can also see what their thought process is when it comes to like looking at you as like the next generation of, the person that might be in their field. And when you start talking to residents who are closer to your age, you start getting more granular about what does the process look like in the immediate term? Like what will the process look like next year? What will they tell me that I need to change? What will they tell me I need to really work on to strengthen my application? Because they were just through it. It makes a world of a difference when you have that sort of big overview of a mentor, like a faculty mentor, and the mentor who is someone who is much closer to your age or your stage of life and can tell you like, this is what I did, this is what I would change, and I want you to learn from that.
I will say that if there's one thing that you can take away, is that if someone, a faculty, a resident, anyone, says that they are here for you if you have any questions or that you can reach out to them with any questions, take them up on it. I was very persistent, and I'm sure they didn't expect it, but they definitely welcomed it because when they say they're here for you, they really do mean it. Like they want this next generation to succeed. And as soon as someone said that, I would just like pepper them with questions, even if they were small or random, but they knew that it meant a lot for me to hear their opinion on it. And it then would like culminate into a meaningful mentorship eventually. And now that I'm like kind of on both sides and I've mentored a couple students here and there, I love it when they reach out and they're like, can you just look at my, away list and tell me if this is good or bad? Like, that's something I would love to do. Let me help you, because I've had so many people help me and I want to be able to pass it down. So if anyone ever says that to you, or if you ask them like, hey, if I have random questions in the future, can I just email you? And they say yes, take them up on that.
Awesome. Thank you. Does anyone have any advice on like how to find a mentor specifically?
For me, I like agree with what Jose was saying. I had two mentors. I had an MS4 and then I had an attending. And so the way I found my MS4 was he was actually on a sub-I when I was on my neurology clerkship. And so when I realized that I really wanted to go in neurology, he was so kind to me and I kind of latched on to him throughout the year. And so asking him, what programs did you apply to? What programs are really great? What programs are not so great that I shouldn't apply to? What scores do I need? All the little like nitty gritty kind of program stuff was who I asked. And then in third year, one of my attendings was very kind. I did not realize they were an assistant program director at the time. Now they're a program director here. But I would always contact her every couple weeks and be like, here's my new updated personal statement. Can you look through my ERAS application? Do you like the way I worded my personal experiences? Here is my list of programs I'm applying to. Do you think I'm competitive enough? Do you think I need to add more or less? And really just reaching out to them a lot. I don't think that they were too annoyed with me, and they're always there to help you. And so being able to find people through your rotations was how I found my mentors.
I would say sometimes you'll seek mentors out, and I think that's a process that a lot of us start doing. And when we're like a first or second year, I think a good place to start when you're seeking out a mentor is through like different organizations related to the specialty of interest. And luckily, a lot of them do like a mentorship match type thing. And I think the other thing about mentorship is that some of it just happens organically when you're not seeking it out. And I think that for me has been some of the most meaningful connections that I've created through mentorship. And I would say with that, it's not necessarily someone that has to be in like the specialty you want to apply to. I think that having a mentor from a different specialty often gives you a unique perspective. I would say I've had different mentors through different stages of medical school, through different activities of medical school, and some of them I've come back to and they have nothing to do with medicine or pediatrics or med peds. And one of them is like in psychiatry, and he read through my personal statement and he offered like a whole new perspective on my personal statement because of that. And so I think that especially when you're going through rotations, you're going to interact with a lot of residents, a lot of other medical students, a lot of faculty and attendings. And I think that sometimes kind of nurturing those really or like there's more organic relationships and finding mentors through those opportunities, that has been something that I've really appreciated. And that's been something that's helped me immensely throughout like this entire application process. So I would say just like hold on to those as well. And of course, go back to your mentors that you might have sought after, but sometimes having those more organic mentorship relationships are also meaningful.
Well, one of the questions we got from someone in the chat was for those who actually kind of switched specialties at some point down the line, how were you able to explain your activities, or how would you explain your activities in the application, though they may not seem as though they had aligned with what you were going into, actually? If anyone has any advice on that.
Yeah, not that I necessarily changed what I was interested in, but I had a lot of varying interests. And so I was involved in like many different types of student organizations. And I think that maybe it's just because it's in psychiatry, but I think people are very understanding of wanting to explore different interests. And I think that no matter what experience you're doing, even if it's like hyper specific, you still take skills from that and you also demonstrate certain character values, which is kind of how you classify things in ERAS anyway. And so it kind of helps to be able to think of things not just so specific to a specialty, but also how it reflects on you and how it builds your character, because that's what people want to know when you're filling out ERAS.
Yeah, I had a similar sort of situation where I had pretty varied interests and ended up publishing a lot in the specialty that I didn't apply to. And for me, when I was asked about that, it was pretty easy to answer because, I had a reason, right? When you make that decision to switch specialties, you're going to have a reason. And it's easy when you're in an interview setting or in a setting where you're actually being questioned to kind of just go through that and walk through your logic and how you got to the specialty that you eventually reached.
I would just add
Awesome.
on to that, just like with general kind of insights. Of course, I'm not a program director or reading residency applications, but I would say that just like looking at it big picture, I would think that, like Alexis said, like Delaney said, I think the big thing is that everyone kind of knows that you're exploring things in medical school. So I think it's totally okay to like have that change and not to be like scared by that change if you do change what you want to do. But I think one, like they were saying, is being able to explain like what your change, like why you changed into what you want to do. And with that, I think one of the things that maybe they want to see when they're asking you like why you made that change or why you went from one thing to the other is that you know like what you're about to get yourself into and you're like aware of that even if you made that switch later on. And so I think you show that by doing activities in that thing that you switched into, by having rec letters from people who can vouch for you in that thing you switched into, and being able to speak passionately about it when you are writing your application, different materials, and during your interview. And so I think if you're able to do all of those things, I think that overall, I feel like they understand that you made a switch for a reason and that they just want to see that you kind of thought it through when you were making that final switch into what you did apply to.
Yeah, awesome. Thank you. One other question. If anyone has any advice on the signaling process, and it's probably tailored to the M3s, but it can be a little confusing sometimes when I've heard about it, about how the signaling process kind of works and how you kind of tailor that specifically.
Yeah, I can speak on that. So I think that the answer is it depends on your specialty because some specialties have like only one type of signal, some have tiered signaling, some have no signals. So you really have to speak with your advisor about that or just other students who have matched before. For radiology, we have a tiered signaling, so like gold and silver. The reality is that a lot of programs, they like kind of customize how they take the signal. So one program might say like, oh, we don't care about signals at all. Some of them might, they really heavily value and they won't interview anything less than like the top signal. Your best bet for that if you're a third year or probably even the subsequent years is to look at Residency Explorer. So that has like the hard statistics on like who got interviewed like after sending a signal, just very objective data as well. But I would encourage you to also look to your kind of upperclassmen who have already gone through like the match because some of them may have like anecdotal like evidence that like, oh yeah, I talked to this like PD and he said like, we're not interviewing you for signal or like, we don't care about signal. So just make sure you cover all your bases.
Thank you.
I was told for OB-GYN, and at least for my mentor, because we were cautious, to strictly apply to have at least 1/3 of my total number of applications be safety programs, just based on like their academic standings, my step score, etc. 1/3 be targets, so usually like geographical, like my hometown, like whatever, and then 1/3 be allowed to be reaches. So just like a city I was really interested in, or like a really great program that I thought I would be a good fit at. And the same thing would apply to my signals. So 1/3 of each in each category for that. And I feel like in the beginning I did a lot of reaches, so just being told that had me reconsider my application. And I told myself if I wanted to keep my reaches, I would have to apply to more safeties. And I think that gave me a good balance and reasonable expectation for my application season.
Absolutely. All right. And then one other question is, how was there anything that you feel as though you would want to do over on in the application system? Anything you feel as though maybe didn't go as quietly as well as you would have hoped and you wish you had done differently?
I feel like no one really tells you how many programs is a good number of programs to apply to. And so whenever you're looking at it, you're like, I will apply to, let's say for nursery, I'll apply to 40 programs because I feel like that's a good number. We get 25 signals, just a little more than 25. Most people will get some interviews from their signals. But when you look at the data, you need to apply to a lot more than 40, closer to 70 on average. The average nursery applicant applies to 70 something programs. And they'll get, an average number of interviews from that, regardless of if they signal it or not. And certain programs, of course, like you said before, that they'll look at things and signals a different way. But I just hope, when I look back at the application, I just wish that there was more sort of talk about how many programs is a good number of programs, and then break that down to the distribution of, these are the programs I feel comfortable, that I could get into, versus these are the programs where I would really love this aspect of the program, versus this is my reach program. Like, how many of each of those do I really, really want to put an effort into making an application for?
I would say just like general advice that I think a lot of us tried to create our own system for was like when we were trying to create our rank list. And so some people kind of establish a system in their mind or on paper beforehand of like what their true priorities were when developing their rank list. I know some of my friends kind of like had scores for each of these categories that they would give like a per category to that program after they interviewed. For me, I like had a whole application spreadsheet or an Excel spreadsheet for like each program I interviewed with, and I kind of wrote like my own sentiments towards how the interview went, like different interactions with everyone that I had. But one thing that I didn't do that I did like closer to when rank lists were due that maybe would have been better to do like at the beginning, just so that I didn't have to like worry about that before rank lists were due, was kind of like creating that system in my head of like, okay, these are my main priorities when creating a rank list, when like choosing which programs I want to be at. And this is kind of how I want to like weigh each thing. So like for me, being close to family and like a support system was really important, but like establishing a weight to that is also important. And so I think that one thing I would maybe have done differently in the application process, which in the end, like I eventually ended up doing it before I submitted my rank list, but I think something that a lot of people did at the very beginning and kind of kept it from going from the very start of the application process and interviewing was having like a set like idea of like, this is how much I'm weighing this, and this is a score I'm going to give to this program after I interview for that category. And so I think that is something that if you can establish in your head or in an Excel spreadsheet, like when you're interviewing as you go, that could be really helpful in kind of creating a list so that once you're done with interviews, you've kind of already established a list for yourself and you don't have to worry about it too much right before rank lists are due.
I would even go a step further and say, I think, something that all the panelists have said in answering this question is that it's all very specialty specific. So I think when it comes to these types of questions in terms of how many programs to apply to, it's worth finding someone in the field, someone who just matched, or a resident or an attending, who can answer the question specifically for that specialty. But also, I think before you ask those questions, it's very important, like Malika was saying, to know what you prioritize, so that instead of just saying, hey, I want to match, help me, you can say, I want to match, and it's important to me to be in Texas, or it's important to me to go to a place with great research opportunities, and you can get super granular. Like you can say, I have an interest in myasthenia gravis, and this program has a great researcher for that disease. What can you do to help me get to this program specifically? So if you know yourself and you know your goals going into it, you're going to get a lot more out of the relationships or the questions you ask, because it won't just be help me. It'll be a specific ask that they can act on more directly.
Thank you.
Sorry. I'll just add to that I think it is really important to like have goals. Also, like not just because of the questions that you might ask your mentors, but the questions that you may ask like while you're interviewing. I think that having like really targeted specific questions helps to show like how interested you are in that program and how interested you are in interviewing them, whether they're a good fit for you. Because when you go through the interview process, some people get so many interviews that it's just really hard to differentiate each program. And so I think it's important that during the interview day, you're also getting information from them of like, okay, how do you do this thing? Like, do you have this specific thing that I care about? I think that is something that you need to be able to do, and something that is hard to do if you don't have those priorities like somewhere in your mind.
Yeah, absolutely. To build on that, actually, I wanted to ask the next question, which would be how did y'all prep for interviews? What did y'all find most helpful in going about the interview process at each program?
I think a few pieces of advice. One would be know your application. I think you hear that kind of when you're even applying for medical school. Know your application. I think for me, what I took the time to really try to do thoughtfully was sit down and look through each of my activities and reflect on the different things I did within each of those activities, because I felt like there was a lot of like breadth and depth in the activities that I did, and not just like a few things that I did as a part of it, but like different things that I could talk about. But even more than that, I tried to sit down and like reflect on each thing and go past like what I wrote in my most meaningful and do this for every single activity and think about like my true takeaways from each experience, and one, how that might impact how I take care of patients in the future, but also kind of how it impacts what I want to do with my life. And for me, I'm really passionate about service, but also medical education and undergraduate medical education. And so being able to tie in those little pieces with my passions was really important for like the interview trail, to make a cohesive story, kind of how Alexis was saying earlier. And so I think spending time just like everyone does this differently. For me, it's like writing it out. And so for me, I was like kind of journaling in a way like, okay, this activity kind of left me with these few takeaways that I will apply to my practice of medicine through these different ways. And I think that that helped in kind of going through each experience and kind of giving true reflection rather than just like surface level takeaways. Other than that, I think, even when you're creating your personal statement and you're creating your like why this specialty, you'll kind of come up with your story, like your individual story of kind of why this is important to you. And so I think being able to express that cohesively during an interview is extremely important, because a lot of the times, at least on the primary care side, from my experience interviewing at MedPeds programs, there were a lot of questions of like, why MedPeds? And so I think that being able to cohesively share your story, your personal statement, of course, is going through a lot of different experiences, but being able to kind of cohesively share that is really important. I feel like a lot of people do like to do mock interviews, so that's always like a helpful thing if that's something that helps you in preparing for an interview. And I think the one thing with the interview cycle is it's very, very long. For many of us, it starts in October, ends for some people in February, for some people January or December. So it spans a few months. And I think the biggest thing with that is knowing that it's going to be a long process. But I think with that, it's also important to remember that if you do your prep really well for that first interview, it'll help for every single interview that comes after that. But also another thing, just really quickly, is to make sure that you do that prep on your end about like yourself and like what you're bringing to the table, but also knowing about the program, because one, that helps you kind of show that you are interested in the program, but also number two, it helps you make sure that you're asking the important questions. And kind of going back to what we were saying earlier about these priorities, something that you'll hear a lot in the interview trail is like, this is an interview not only for like you and like if you'd be a good fit for the program, but also for you to understand if this is a good fit for you, like this program's a good fit for you. And the best way to do that is to like do your research about the program and being able to like ask them the tough questions. And so I think if you kind of do your prep beforehand of that program, you'll be able to do that better.
I loved having a mock interview. I found a faculty mentor, and I like asked for 30 minutes of their time to sit down and just ask me what they would want to know about any resident applicant. Then they gave me feedback on it, and it kind of helped me realize that, oh, like my eyes dart too much when I get nervous. Like I need to look at the camera, I need to have my ring light a certain way. And just like little things. And weirdly for OB-GYN faculty, like they really cared about that. So that's what I did to practice. And after I submitted my application, I also started looking for commonly asked questions for residents, especially specifically within your specialty. And I would kind of work on the most common ones. And you should definitely have like, me about yourself, like why this specialty, why this program, kind of down pat. But I also would have my own little template of questions I would like to know about every program. And then during every interview, I would kind of just write down if they answer anything at the social. And then whatever they didn't answer during interview day, I would ask them during my rooms. And the night before an interview, I would maybe take like 5-10 minutes and just go through their website, like their social media and what they have, just to kind of get an idea of what their values are. And if there's anything that I saw that I was like, oh, I kind of have a question about this, I would like to hear more about your midwifery program and like the way they teach you and like what does this look like for your program. And it kind of just sparked questions organically, and they seemed to really appreciate it when I did ask questions, because it showed that I clearly did my homework ahead of time.
Yeah,
Absolutely.
also,
Go for it,
yeah.
Alex.
Yeah, no, I was just gonna say, like, to echo like people talking about knowing your application. I think that when you're customizing also questions you're asking the programs, it's important to like already have like a preset list and tailor them specifically towards the program. I think for all of us, one of the least favorite questions we had by the end of the cycle is like, do you have any questions for me? Because you're gonna be asked that every single interview. And like, you'll have the social, you'll have maybe like another resident part during the panel, and you'll like run out of questions to ask, like that are organic. So that's why you have to just be able to prepare those ahead. So if I had known for my first few interviews, like just to have like a laundry list so that I could go through them, and I think that would be good.
Thank you.
Going off of that, when you are asking your own questions, don't like go to Reddit or Student Doctor Network and just ask the top 3 questions that are listed there, because every other applicant is asking the same questions. Like what I did was I thought about the questions that they're asking me, the ones that really make you think and like, oh, that's a good question. And I tried to come up with questions that made them think. Like, tell me about your favorite interaction you ever had with a resident, or when a resident was struggling in the past, how did the program support them? And you'd be surprised how many of the attendings or the program directors are sitting there like, oh man, I've never thought about that. So if you can just like take some time to make them think, I think it'll make you stand out. And on a larger scale, when it comes to interview prep, I don't think there's any substitute for repetitions. So be strategic about how you're scheduling your interviews. Like if it's your number one program and they offer multiple dates, don't make that your first interview, because just by nature of doing it more, you're going to get better. Like, it might come up that they have a global outreach program and you can go abroad and you'd never even thought about that. Well, then you can ask about it at future interviews. And it gets to the point by the, back end of the cycle that the real only prep you have to do is read their website, because you know your application so well. But if the invitations start rolling in and it's a program that you're like meh excited about, schedule them for October, November, use it as a practice run, because then you'll shine, you'll look more polished when the ones that you really care about come up. But also don't put it too late, because you will get burned out by the end of the season. So like middle third, middle half is a good spot to put your top programs.
I think what's
Awesome.
also important is figuring out what's really important to you in programs, and asking those questions during the night before with a resident social. So for me specifically, what was really important was work-life balance. And so asking the residents, do you have time to do things that make you happy, like your hobbies during residency? Do you guys, and something that was also really important for me was the residents being friends with each other, hanging out outside of work. And so asking them, do you guys get together outside of work? Are you guys friends? And it'll be shocking. Residents will be very honest and they will say, no, we hang out only at work, or yes, we do all these other activities, or no, there's really no time to do what we love, just eating and sleeping. And so finding out what's really important to you, and asking those hard-hitting questions during the social.
Awesome. Thank you so much. Well, I want to extend a thank you to each and every single one of our panelists here today. It has been amazing hearing the information. You've answered a lot of my questions, which I'm very appreciative of. I also wanted to offer out to everyone in the chat that feel free to reach out to Med School Mentor for any mentorship or advice, and to be connected to these panelists, hopefully. If you would like panelists, you can leave information in the chat. Also, you can let those who reach out to us who want to connect with you, we can go through that channel as well. And then I'm also going to leave in the chat all of our socials, so X, Insta, LinkedIn, and then the website where you'll be able to reach out to us on. So
Yeah. Thank you everybody for your time. It's an exciting time. You've all mashed, you've all moved on to the other side. But yeah, thanks so much for your time on a Monday evening. Yeah, we really appreciate it. We're hoping to do another webinar, part 2 of this with more specialties. So stay tuned to our social media, and we'll keep you guys posted when that happens. Thanks again.
thank you. Thanks, June.